Hello, hello. Welcome to Georgia Plastic and Reconstructive Surgery. We are here in celebration of National Cellulite Day. Believe it or not, that is a holiday now that there is an effective treatment and solution for it. So it is now officially something worth celebrating. So thank you for joining us today. So we're going to go through a little bit of a presentation just to give you some information on what this treatment is that is being offered by Georgia Plastic, and some very exciting good news that is being put into the market because of the celebration. So let's start off by just giving you a little information on what Cellulite is, how this product works, what it does for you, and how you can get good results. And then we'll have some time for some Q&A. So it's time for no more Cellulite nonsense. That being said, let's go ahead and fill you in on exactly what Cellulite is. Are you aware that Cellulite actually affects 90% of women? And even more so, are you aware of the fact that it doesn't matter what you do, it's not your fault? You can be any shape and size, you can be any ethnic background, you can be super athletic, you may be sedentary, it doesn't really matter. Whatever you're doing, it is not your fault. So 90% of women suffer with this, and it is not a result of anything that you're doing or that you've done. So we know that everybody has been searching for a resolution for this, and we're excited to have Avéli as a solution for you. So that being said, what is cellulite? Let's go into exactly what it is. So cellulite is a depression caused by a tethering down or anchoring down, if you will, of an anatomical consideration called a septa. So these fibrous bands that tether the skin down to the structures down below and cause the dimple that we see. So as you see from the graphic on the screen, the dimpling on top is caused by our anchor down here below that is anchoring that tissue from above down to the tissue below. So again, this is a genetic, hereditary type situation. This is not caused by anything that you're doing, yourself. So Avéli, it's a very, very simple device with a very, very great resolution for a very complex problem. This is a minimally invasive procedure that is done in office. It is done under local anesthetic. There is minimal pain, minimal downtime, and it provides for long-time visible reduction of those cellulitic dimples in the butt and the thighs. So what you get from this is smoother skin. So long-term smoother skin. And in the clinical studies, in fact, we had 84% of patients actually clinically achieve meaningful improvement at 3 months. And the same response rate was actually there at about that 6 and 12-month mark as well. So long-term results are visible there. So how does Avéli work? So it's a simple tool. And this is the device right here. So what we do is we identify the septa. Once we have numbed you up, we identify the septa by inserting the device. Again, you are numbed and you're not feeling any of this. We recreate the dimple as you see on the screen here. And then we push out the little hook and the blade, and then we relieve the septa. So once we do that, we identify it, we verify it, and we release those septa in order to get rid of those depressions. Over time, your results will continue to get smoother and smoother as your body recovers, and you will get beautiful, lasting results. So what can you expect as a patient that's getting treated? It takes about an hour. We're going to numb you up, as I said earlier. We're going to do the treatment, and then you're going to, just like any other procedure, you're going to take your before photos. And then when it comes to downtime, you're going to have minimal downtime wearing some compression garments, such as a tighter pair of yoga tights. You can find whatever option works best for you. I believe that we have compression garments here at the practice that they will provide for you as part of the build-in with the quote. So that being said, that is all bundled in there. Now, during the procedure, once we've numbed you up, that is the area where we're going to be working in. So that'll be in the lateral thighs, which is out here to the side, in the posterior thighs, on the back, or in the butt. So it really just depends on the area that you need treated. Not everybody has cellulite in all of those areas. And then some people do have cellulite in all those areas. So it's really case-by-case basis. And Skylar and Dr. Okoro will ensure that you are well taken care of through that procedure. So during the procedure, once they're released, you're going to get up and you're going to walk out of here. So immediately after, majority of patients did resolve to, get back to normal activities within 24 to 48 hours. You might get a little bit of mild pain within that first 24 hours, but you don't need some strong painkiller in order to manage that. You can manage that easily with Tylenol. In fact, you might have a little bit of bruising and tenderness as well, but there are things that we do in order to minimize that to the best of their capabilities. And again, in the days following, we want you to wear those compression garments for as much time as possible for each of those days in at least 2 weeks. just like any other aesthetic procedure, let's avoid the sun because there's going to be a minimal insertion point, a little incision. There's not going to be necessarily any for any stitches or anything of that sort, but you definitely are going to be avoiding bathtubs, hot tubs, swimming pools, oceans, beaches. Let's just stick to the showers. So as time goes on, the bruising will dissipate and everything will continue to smooth out and get better and better over time. So let's look at some meaningful, lasting results that this product has actually obtained. And this is directly from the clinical studies. If you'd like to see results that have been gotten here at Georgia Plastic, take a look on their Instagrams because they have shared direct results of some of their own patients here. So this is before the patient was treated and 1 year later. So it's a very, very effective result. Here's another example of before and after at 1 year. So again, going back to lasting results. And another example for you. Now, with regard to FAQs, common questions that we get. Does it only treat cellulite dimples? Yes, what we treat is cellulite. What we do not treat is laxity. However, here at Georgia Plastics, they do offer other technologies that can provide you a great combination treatment in order to get you an even better result. That being said, you would need to come in for a consultation to determine what that looks like, and they will draw up what that care plan looks like for you. They have a great team here, and they will ensure that you get exactly what you need. Will you need multiple sessions? It is designed to be an in-office procedure with one treatment. That being said, it's still a conversation that needs to be had with your provider about exactly what that looks like. Next question, how long does this take? How long am I going to be tied up in the office? 60 to 90 minutes tops. That being said, we're going to have to get your photos, and we want to make sure those photos are great so you can fully see the results that you have gotten through that procedure once we get through the recovery period. What does the downtime look like? Again, 24 to 48 hours. With regard to working out, let's take a little break. Let's not work out our lower body for maybe a few days, maybe a week. Let's continue with upper body exercises. Feel free to walk, all of that, but definitely no lower body lunges, squats, CrossFit, Orange Theory, any of those types of deals. Let's take it a little bit easy. Then how quickly you're going to see those improvements. You will see results pretty quickly, but they will continue to get better and better over time. So while you may see some very quick results, give yourself time to let everything fully settle in and heal the way that it needs to. So again, going back to how long will it last? This is a very common question. So it's long-term reduction in the appearance of cellulite in the buttock and the thigh areas. That is our FDA indication. And there can be even more answers provided at an office for you. So that being said, you will have great results out to 1 year of observation, which is what is seen in our clinical studies. Here's a little peek at our safety information. This is also available on Avéli.com, so feel free to take a look at that. Now let's look at how this procedure actually happens. So you will come in and the provider will mark your cellulite ahead of the procedure so that we identify our targets that we are going to go after. Once they have done so, we will have you lie down, we will get you nice and comfortable, and we will create an insertion point where we can navigate the Avéli tool directly to where your cellulite dimples are. What you're seeing here is us checking to make sure that we are within our marks. At first we were not, but now we are. See how the dimple goes down right in the middle of the marking. Sometimes it takes more than one pass in order to get those cellulitic causing septa released. On average, in our clinical studies, we saw that sometimes dimples have up to 10 releases per dimple. That's not every one of them, but sometimes it's that case. Sometimes it's not. So once we do those releases, we release it and everything will pop back up and continue to smooth out over time. Here are some additional before and afters directly from our clinical studies. This is before and at 1 year treatment, and these are not retouched. I know that's hard to believe nowadays, but these are genuine photos. Again, a great result here. And a great result there.
I do have some questions.
And another great result. Yeah.
Or we can wait.
And it appears as though we have some questions. So let's see what these questions are.
Well, I have just one main one right now. How painful is it after the procedure? What do you usually see with your patients?
That being said, I think it's a good time for us to bring up one of our providers who is actually going to be one of the people doing the treatment. So everybody meets Skylar. So yeah, Fill them in.
So typically patients do really well, and they do feel a little bit of soreness for the next day or two. But afterwards, everything's really taken care of with some ibuprofen or Tylenol, easy over-the-counter medications.
That's awesome. Sorry, I'm just going back to our questions. Just a lot of that.
I will tell you some of the comparisons that I've heard direct from patients is that if you have done one heck of a booty workout, then that is about the, what it's going to feel like for a couple days, a few days afterward. So there might be that little sensitivity in that first 24 to 48 as you sit on the toilet, just like when you do a filler lower body workout. But outside of that, you're good. There's no risk with this like there is with, like a fat grafting or something like that, where you don't want to sit. You just might be tender in sitting. So there's no reason why you cannot sit.
How much time should you take off of work leading into that same kind of area? How much time?
Really, you don't have to. If you're worried about the pain or anything like that, you maybe could take 2-3 days off of work, but it's really not necessary. A lot of people are able to get it done, wear their compression garment, and then go to work the next day again, because you're really just feeling sore more than anything.
So you would suggest getting a compression garment?
Absolutely. And the compression garments that they have here are great. You need to wear that as much as possible. And the reason for that is it helps for the bruising to dissipate and actually go away quicker. We can't dictate how much bruising anybody will have. Somebody may be a heavy bruiser in general, and some people don't bruise very much at all. We saw it all over the spectrum in our clinical studies. So that being said, whether you're a light bruiser or a heavy bruiser, wear your compression garments and do that in order to help that bruising go away quicker. It's the same as you would with any of your other treatments, right?
Yeah, and it's also going to help with any you may have after. Because like any procedure, you are going to have some minimal swelling after this because we are kind of, going under the skin and making a small incision. And so because of that, the compression garment's also going to help with any swelling you may have.
Cool. We did get some, somebody said, love Skylar. I love Skylar. And she even went over to Instagram from TikTok. So you have some fans on here.
So just so everybody knows, in celebration of National Cellulite Day, there is actually a promotion that is going on. Once you get treated and have completed your treatment with Avéli, you are able to get a $250 gift card, and that is provided by the company for anybody that's treated with Avéli and has proof of treatment, and that goes from September 5th today all the way through October 31st of this year. So again, September 5th to October 31st, any treatments with Avéli will be eligible to log in, input your information, and get a $250 e-gift card from Revel Aesthetics, the makers of Avéli.
Awesome. And then here at Georgia Plastic, we also have a little special going on for you guys who joined online. We're offering a 10% discount off of the Avéli treatment if you are online with us today.
Which is pretty stellar if you combine the $250 additional as well as that 10%. That's pretty good.
We just had, we had 2 separate people say that they just had this done. So that's great. And one of them was the one that was like, I love Skylar.
We love that.
If you guys have any questions here on the live, you can go ahead and put them in our comments. But I know some people here in our audience also have some questions, right?
Yes.
Okay, cool.
Skin tightening. Skin tightening with Avéli. What should I expect in regards to skin tightening?
Yes, so here at Georgia Plastic specifically, we like to combine our Avéli treatment with Morpheus 8, or some other skin tightening modality, but we use Morpheus 8 here. And it's a radio frequency microneedling, and so it's really good to pair with the Avéli because while we're doing work on the inside, it's also good to kind of do that microneedling on the outside to help tighten things up a little bit and give a more finished, polished look.
Sorry, not to be annoying. Can we switch this slide just because it is a buttock? And social media might not love that.
Sorry.
No, those are great. I just, for like long term, fantastic. We love seeing these amazing results from Avéli.
So at this point, I may need to go ahead and stop sharing my screen. So
Sure.
if
I mean, you can
transfer
keep sharing
straight
it
over
for
to-
that.
Okay.
If you want to keep sharing it for the Zoom, that's fine. But it's just, or just put up the Avéli Whatever. It's fine. Or I can turn it off.
Okay.
Yeah, just unplug it.
Yeah, go ahead.
Okay. Can I tell this? So I am interested in a reduction, but I do have cellulite as well. Is this something I can pair with a surgery?
Yes, for sure. In fact, pairing this with especially like a BBL reduction, which seemed to be the craze lately because everybody went big and now we're going back small. So yes, this is perfect to plan with a BBL reduction. In fact, it really kind of finishes off the whole look because it looks great when you get the results you want, but having the cellulite there still kind of leaves something to be desired. So after adding the Avéli treatment to it, you get a much more rounded, smoother appearance as well.
You said I don't have to be put to sleep for this, right?
No, you don't have to. Obviously, we are able to do it down in the OR under general if it's combined with another surgery of some type. But no, it can be done up here in the office. We like to give you maybe some laughing gas, and we do numb it up, but perfect up here in the office. No sleep needed.
Will I need someone to pick me up the day of the procedure?
Yes, so you will need somebody to pick you up the day of the procedure, specifically if you do get any type of medications up here in our office. So a lot of times patients do like to opt to get some type of medication to relax them. And because of that, we do require you to have a ride home if you do choose that option here at our clinic.
And if they don't choose that option, safe
Yeah.
to drive home.
Yeah.
Cool.
Awesome.
And
So what are the chances that I'll need this treatment in the next 5 years?
So, like you said, with their clinical trial, it's up to 1 year. But typically, when people get it done, what we've seen is that it permanently prevents the cellulite that we treat. However, it cannot prevent new cellulite from forming in other areas of your buttock. But if we treat, these specific dimples that we circle, you should not expect them to come back at all.
so technically it is a one-time treatment, ideally.
Yes.
Cool. If you guys have any more questions in the live here, they are answering our live questions about our Avéli, which is our cellulite treatment, FDA approved. Is it the only FDA or one of the only FDA approved?
It is currently the only FDA cleared
Woo.
treatment with long-lasting results for cellulite on the market.
That is awesome. Any other questions from our audience here, guys?
Is there, besides the buttocks reduction, what about thigh lifts? Is this something I can combine with a thigh lift?
Yes, you could. You could for sure. That also depends too on your surgeon and what they're able to kind of do in a time frame. But it's not something that you have to stray away from. It just kind of depends on the time frame for the surgery.
We have a question, if you guys can give us a cost estimate about what it kind of looks like.
Well, so here at our office, it's gonna look about $4,500-ish and up to $8,000. Just kind of depends on what all you get in that package
Sure.
and what you decide to combine with it.
But just as a reminder for people watching, that package also would include the compression garment,
It
right?
would include your compression garment, doing the skin tightening treatment with it, as well as any medications and bruising package and all that kind of stuff.
Cool. Sounds like an all-inclusive quote.
Yes, very much so.
How much is the consultation fee for this?
So the consultation fee would be $100 with me here in the office, and it would be $500 to see Dr. Okoro. Or $50 if you book today.
$50 with
With me.
Skylar today. If you book today and give us a call today.
Okay.
We have our front desk on the phone, so you guys can call literally right now for it.
Will the consultation fee go towards it?
Yes, your consultation fee will go towards your procedure.
Cool.
Awesome.
Is there any other things that you think that we should know about it? I mean, if we want to reiterate some of the main points for any of our new viewers, that'd be awesome.
Yeah, just for those of you all who just joined us, Avéli is again a new FDA cleared treatment. It's not new to Georgia Plastics. It's now been here for 7 months ish. So at that point, they are definitely one of the premier providers of it in the state of Georgia and especially here in the city of Atlanta. So they are having great success with it and great results. This product is giving great results where many products have come to market and have failed and have not been able to provide lasting results that women not only want but what they deserve. So this is a very simple, easily done in office procedure, or as we were saying earlier, sometimes you and your provider may discuss the opportunity of you to have this as part of a greater treatment package or treatment plan. But again, that is something for you all to discuss with them. And folks are very happy with the results.
Awesome. And you said the downtime is minimal.
Yep. So we're down to 24 to 48 hours of downtime. And again, that's not like where you have to stay locked up in the house and you can't do anything or anything of that sort. Again, as we were discussing earlier, technically you don't even really need to take off work. You might have some pain and sensitivity following this. You can manage that, with just normal Tylenol. You don't necessarily need an opioid pain med or anything of that sort. Something that's like really strong that's going to just like knock you out. You're going to be able to resume normal activity outside of lower body exercising, because we want you to rest that area that has been treated and give her a little bit of rest. So, definitely make sure that you do that. But outside of that, you'll be good to go.
As far as like working out, like, is there any restrictions with working out after doing Avéli?
Yes, so like he was saying, we definitely want to give the lower body, specifically the buttocks and the posterior thighs and side thighs, a break for maybe about a week, up to a week after surgery or after the procedure, because we want to make sure we give it a rest. So that means kind of limiting no squats, no lunges, anything like that that really targets that area. Again, some light walking is okay, and doing upper body exercises with some type of dumbbell is fine, but we definitely want you to rest your butt region for a little bit.
You think so? Light cardio is gonna be good.
Yeah, doing some light walking, and we always want you to walk anyway, because walking helps with healing and gets everything flowing. But
Cool.
Well, as we said, there is a promotion going on if you call and you book your consultation with Skylar today. So her standard fee of $100 has been lowered to $50. Her standard fee going forward is $100 for her consultations and $500 for Dr. Okoro. There is a 10% off promotion on the pricing here at Georgia Plastic and Reconstructive right now. And on top of that, for any treatment on, for an Avéli treatment between September 5th today and October 31st, you will receive a $250 gift card from the makers of Avéli Rebel Aesthetics.
And if you're interested in seeing about more of like the procedure and what happens, feel free to head over to our YouTube. We do have the animation that we showed today on our live. And if you guys have any more questions, feel free to message us here on any of our platforms. Thanks guys so much for joining us. We appreciate it.
Thanks for joining.